So pharmacology for how does beta 2 causes bronchodilation. So during the emergency situation, what happens? The bronchodilation takes place. So how this bronchodilation takes place? If this is the lungs, in this is the trachea, and then primary bronchiole, then these are the alveoli. Okay, if we do the deep view for the primary bronchiole, what we will see? We will see that this is the primary bronchiole. Okay, in this, these are the primary these are the smooth muscles present inside the primary bronchiole, so there will be a lots of smooth muscle. So if this smooth muscle contracts, then what will happen? The If this smooth muscle contracts, then the alveoli present inside the bronchiole, that is bronchial alveoli, it will also constrict. So it will constrict means it will get narrower, it will get smaller. So to enlarge or to open up the alveoli, what we have to do? We have to relax the smooth muscle present in the bronchial. Okay, so this bronchial smooth muscle, to get relaxed, so there should be the stimulatory receptor or there should be the inhibitory receptor. Yes, there should be inhibitory receptor. So which receptor will be there? Beta 2 receptor. So what does this beta 2 receptor causes? Beta 2 receptor. What does this beta 2 receptor causes? This beta 2 receptor will cause the relaxation or inhibition of contraction of the smooth muscle present in the bronchiole, that is bronchial smooth muscle. So when this bronchial smooth muscle get relaxed, the lumen present inside the bronchiole will open up. Now what about the blood vessels present inside the bronchiole? Now if we see more deeply, then we will see there will be more blood vessels present. Okay, now the smooth muscle, bronchial smooth muscle will get relaxed, but this blood vessels or bronchial blood vessels will get constricted. Why? The reason behind that is, if the blood flow inside this blood vessel will increase, then the the inner side of the bronchiole, that is the lumen side, will swell up, it will become edematic. Okay, and it will also become hyperemic. So edematic or hyperemic means the blood flow will increase in the inner part or the inner region or inner part of the bronchiole. Okay, so in this part, if the blood flow increases, then it will become hyperemic. Blood flow will increase. When blood flow will increase, it will swallow. So when the inner part of the bronchiole will swallow, that means what will happen? It will become more narrower. The lumen of the bronchiole will become more narrower and it will become more smaller. Okay, so that's why, to decrease the swallow or to decrease this inner part to become less hyperemic, what we have to do? We have to shrink the blood vessels, alveolar blood vessels. So we will shrink the alveolar blood vessels, and also we will decrease the blood flow inside the alveolar blood vessels. So to decrease the alveolar blood vessels or to shrink the alveolar blood vessels, to constrict the alveolar blood vessels, or that bronch or bronchial blood vessels, what we have to do? We have to constrict this part. The smooth muscle, obviously there will be the smooth muscle present inside the bronchial blood vessels. So the contraction of the smooth muscle of the bronchial blood vessel will take place. So for contraction of the smooth muscle present inside the bronchial blood vessel, which receptor should be present there? Stimulatory receptor or inhibitory receptor? Yes, there should be the stimulatory receptor present. So the stimulatory receptor is alpha 1. So this alpha 1 will cause the contraction of the smooth muscle of the bronchial blood vessel. And when the smooth muscle of the bronchial blood vessel will contract, the constriction of the blood vessel will take place and the blood vessel will also become narrower. and when this blood vessel will become narrower, there will be, what will happen, there will be less blood flow, and when there will be less blood flow, the lumen part of the bronchiole will open up and it will become little bit dilate, and this part will become dry, and the secretion will be also less in that part, and after that the bronchodilation will takes place. Okay, now I want to tell you one thing, that this beta 2 receptor and alpha 1 receptor are adrenergic receptors. Okay, so adrenergic receptors are also called 7-pass receptors. Why they are called 7-pass receptor? Because this receptor passes 7 times in the cell membrane. Okay, and it looks like snake, so they are also called serpentine receptors. See there. So they are also called adrenergic receptor, they are also called serpentine receptor, and they are also called 7-pass receptor, because 1 2 3 4 5 6 7 7 times they pass through the cell membrane, and it looks like snake, so they are also called serpentine receptor. Okay, thank you.